MTP number 25. And Dr. Sormanto is not here with me today because his father's sick, but his father will be back soon. His father has probably implanted more Latin men than anybody I know, except for maybe Dr. Carrion Sr. When he comes back, we're going to have an all-Spanish MTP. So send in your questions in Spanish. We love that. It'll be fantastic. So today's question comes from Russ, but guess what? It answers Randy's questions, Fred's, Chad's. So I'll read the question. Does the penile implant restore length and or girth lost after unsuccessful use of pills and injections following a radical prostatectomy? So the answer to that is the only thing that stops atrophy is the penile implant. Now, if you actively use your implant, if you're active in your rehab, and that first year is really important, what I tell my patients is during the first year, at least twice a day, pump it up all the way up. Bend it up, bend it down, bend it left, bend it right, and then try for a couple more pumps, and guess what? You will get back some of what you've lost. It's absolutely true. After a radical prostatectomy, you'll lose somewhere between 0.5 and 5 centimeters every 14 months. So you can stop the process and then actively try to increase your length and girth. He also asked, can the implant be inflated progressively? That's exactly what I just told you. As you continue to pump, the implant will take on more fluid. Anybody that's taken out older implants will tell you you can always upgrade to a larger size. I can't remember if it was Randy or Fred, but somebody said, you know, I can only get so many pumps. You pump with 2 thumbs until you can't pump anymore. And then practice that exercise, right to left, up and down, and you might be able to get a few more pumps. He also asked, how many pumps does it take typically to fully inflate an implant? And I'm laughing because the more pumps, the better, right? The bigger your penis, the more you pump. So all of my patients, all of you guys that have one or might be getting one, pump until you cannot pump anymore. And then finally, he asked me, and this is specific to our practice, is there visible scarring that remains in the infrapubic area? The incision is probably that big, 1.5, 2 centimeters. If you have hair, you'll never see it. If you don't, it could easily be hernia repair, done laparoscopically or something like that if you're trying to conceal it. So, Russ, your questions answered. Randy's, Fred, Chad, and all you guys, thanks for submitting it. And if I missed something, Randy, Fred, Chad, on what you were asking, please send back. Once again, thanks for coming. Don't forget to vote.